Hello, ladies and gentlemen. Welcome to our channel. Today we discuss about the yellow fever. So the very first step is the introduction of yellow fever. Ladies and gentlemen, it's not a new term. It's a very common. Yellow fever is a viral disease spread by the bite of specific kinds of mosquitoes. These mosquitoes and yellow fever are found in areas of Africa and South America, located in the tropics and subtropics. The mosquitoes are infected when they bite primates who have the virus. The yellow fever virus can have a range of symptoms. Some people may have no symptoms. It can present with mild flu-like symptoms but can also be deadly in its most severe form. So, ladies and gentlemen, at the start point, at the starting of the yellow fever, there is no specific symptoms. So, at the after 6 to 7 days, the symptoms of yellow fever is just like the flu-like symptoms. The yellow fever virus can have a range of symptoms. It can present with mild flu-like symptoms, but can also be deadly in its most severe form. You could have flu-like symptoms with itches, pains, and fever, or you could begin bleeding and develop liver disease. Symptoms take about 3 to 5 days to develop. So, ladies and gentlemen, after 6 to 7 days, yellow fever shows its basic and important symptoms. In the next slide, we have discussed about the severe symptoms and the normal symptoms of the yellow fever. So, the next question is the who does yellow fever affect? We know that some diseases are the endemic and some are the pandemic. Some diseases affect the people in a specific area, and some diseases affected all over the world, like other diseases like the coronavirus and the hepatitis virus. People who work or live in the forest of the subtropical and tropical Africa and South America are most affected by yellow fever. So, ladies and gentlemen, the most affected area of the world by yellow fever are the South Africa and South America. The some special specialists of the jaundice and the liver, they observe some people in the US who are affected by the yellow fever. So, after research, they can conclude that travelers from the US or other countries to these areas are exposed to the disease by contaminated mosquitoes. So, the main important is the some people may have no symptoms. So, how common is this condition? There are about 200,000 people in the world who are infected each year with yellow fever. The condition causes about 30,000 deaths per year. So, ladies and gentlemen, in each year there are 30,000 people dead because of just yellow fever. So, the most affected persons are present in the Africa. About 90% of the infected persons are present in the Africa. So, there are some symptoms and causes of the yellow fever. So, there are some symptoms written below. It is possible to have yellow fever and have no symptoms at all. If you do have signs and symptoms of yellow fever, they might be less severe or more severe. Less severe symptoms may include fever, headache, body itches, tiredness, nausea, and vomiting. These are the some less severe symptoms of the yellow fever. Next, there are some conditions of more severe persons. These are the very high fever. Jaundice. Jaundice is the skin and whites of your eyes turn yellow. Mean the color of the skin turns into yellow, and the color of eyes become yellow. The color of urine also become yellow. So it's the symptom of the yellow fever. Second is the hemorrhage. Hemorrhage is the bleeding. bleeding from the nose, bleeding from the rectum, bleeding from the mouth. So the third one is a shock and liver failure also, kidney failure and suddenly death. So, ladies and gentlemen, here is the some introduction of the yellow fever and its symptoms. Some are the more severe symptoms, and some are the less severe symptoms. So, if anybody has any question about this topic, you must question your into the comment section. Our expert team will discuss with you as soon as possible. Take care. Thank you.